How would you like for your healthcare to cover all your medical needs at a lower cost to you than you're currently spending? Sounds great, right? Well, that's the basic idea of Medicare for all. But a lot of folks are wondering how we're going to pay for it. In this video, we're going to show you how. Now, we're specifically going to be talking about the state of Massachusetts, but this information should still be valuable to anybody who lives in the United States. Keep in mind that loads of federal reform start from taking the lead of state governments. As we're shooting this, there are two bills being developed in the state House and Senate by legislators, and they should be hitting the floor soon. But before we talk about how these bills plan to change our current healthcare system, let's talk about what's going to stay the same. First off, this is not socialized medicine. These bills won't make medical professionals government employees or outlaw private practices. They also won't force residents to change doctors. Actually, you can keep the doctors you love and see specialists that you might not be able to under your current plan. And finally, these bills aren't just gonna give people free healthcare. Currently, all Massachusetts residents pay taxes into Medicare, Medicaid, and Mass Health, even if they don't qualify for those programs. Under the proposed Medicare for All legislation, those residents will directly benefit from the taxes that they're paying into the medical system. So, now we've reached the question that anybody advocating for healthcare is constantly asked. How are we going to pay for it? To answer this question, first we have to break down how the current system in Massachusetts works, and what it costs. The healthcare industry in Massachusetts is funded through a combination of taxes, insurance premiums, and direct payments by patients. These costs cover the prices of hospitals, prescription drugs, nursing home care, doctor salaries, dental services, other professional services such as behavioral health, home health care, and notably, administrative costs. Right now, we have a 2.9% payroll tax split evenly between employers and employees that goes to pay Medicare, Medicaid, the VA, and other public health programs like nurses and public schools. This means that residents in the median income bracket with no health insurance still pay an average of $635 annually to healthcare taxes. But let's say you want health insurance for yourself. Most people get their health coverage through their place of work. Instead of choosing a plan yourself, you have to accept whatever options your employer gives you. Employers will often choose plans with high deductibles and copays, the amount you have to pay, and low premiums, the amount they will pay about 75% of, so that they don't go out of business paying for their employees' healthcare. Even those low premiums can account for huge spending for a business. In fact, when asked, the big three automakers all supported an expansion of Canada's Medicare for All system, where they save money over hiring people in the US because they don't have to pay for their medical care. If not having control over how much you pay is a big enough turnoff that you want healthcare from somewhere other than your employer, you have two options: either private insurance or mass health. Maybe you can find a private insurance plan with lower copays and deductibles, but now you're stuck paying the premiums, which makes private plans almost always more expensive than those provided by an employer. It's also become such a huge administrative task to get and maintain healthcare that many companies have employees specifically designated to handle that element of operations. So, for a private citizen, it can be a grueling process. Mass health is another option where lower income residents can apply for subsidized healthcare through the state. This system is great as an idea, but unfortunately not too many people qualify. Those who do have to jump through a lot of hoops to find out which plans they qualify for and which plans are right for them, not to mention deal with government websites. And no matter where you get your healthcare from or how much you're paying for it, every plan comes with a provider network, which limits the hospitals, doctors, and specialists you can see. This makes choosing insurance kind of like answering a riddle from the healthcare troll. You need to get your tonsils removed, have a therapy session, and get your foot checked out by the podiatrist. Your provider network can only carry 2 of them across the river at a time. Which insurance plan do you choose? If all of this sounds exhausting, you might find yourself among the nearly 30 million Americans that don't have insurance. And that could mean that a trip to the hospital in an ambulance could be expensive enough to dismantle your life. At the end of the day, the average Massachusetts resident will spend about 20% of their annual income in 2021 on personal medical expenses, whether through premiums as an employee or employer, copays, deductibles, or out-of-pocket costs. For someone making the median income, that's more than all three of the COVID stimulus checks combined. Look, when we talk about the high cost of medical treatment in America, normally the argument is that that's okay because we're paying for the best medical treatments in the world. But sadly, this is a total myth. And in fact, as the costs of our medical system have gone up, our average life expectancy has gone down compared to the rest of the world. So, why are things so expensive? A big reason is administrative fees, which make up about 12% of our state's total medical costs. This is the money that's needed to pay insurance companies to review whether or not you're eligible for treatment and to write up the bills. On top of that, some of the money we pay doctors has to go to the 6 weekly hours they spend discussing billing with those insurance companies when they could be treating patients. And another 13% comes from monopoly pricing. Right now, there is nothing stopping drug companies from charging inflated prices because they are the only ones that can get you the drugs. For-profit hospitals can team up and raise their prices together. If you have nowhere else to go, you have no choice but to pay for their inflated prices. In total, 25% of Massachusetts medical costs don't go towards anything treatment related. The insurance companies don't need that much profit. To quote UMass Amherst economics professor Gerald Friedman, the head of the Centers for Medicare and Medicaid Services, responsible for health insurance programs covering nearly half the population of the United States, is paid a bit less than $250,000, while the CEOs of 7 large health insurers average over $16 million a year. The average health insurance CEO is paid more in a week than the CMS head is paid in a year. These issues in our current system have left 29% of Americans underinsured, where their health insurance does not cover all of the services that they need to survive, and so they're paying out of pocket in addition to their insurance fees. This has led to tremendous personal debt in a world where crowdfunding to try and attain life-saving treatment is the norm. 60% of all personal bankruptcies in America are caused by medical debt. Over a quarter of Americans delayed treatment for medical issues in 2018, and this only leads to higher medical costs down the road. It's like the difference between maintaining your car regularly and having to replace your engine because you couldn't afford an oil change. So, the current system is broken. But how does the new system plan on fixing things? Well, the proposed improved Medicare for All bills plan on using a tactic that's been hailed as radical. We would like to take your tax dollars and make them directly benefit you. There would be a 10% overall payroll tax broken down into 7.5% from the employer and 2.5% from the employee. It would come out of your check and go directly into the funds for healthcare. Sure, this is more expensive than the 2.9% tax that already exists, but this tax increase would be the only payment you would need to make for healthcare coverage. No more copays or premiums. Typical health spending for someone making median income goes down from $8,750 per year to $600 per year. To make things even sweeter, this system would be single payer, meaning that everyone has the same health insurance plan. As I said in the beginning, you can still keep whoever your current doctors are. But now, everyone is in network, because there's only one network, one single payer. We can bring the costs of insurance administration down from the current rate of 12% to the 2% cost that Medicare spends. We can also save a significant amount on provider administration. If every doctor is in network, we no longer need people whose job it is to continually contact different insurance companies about billing for their practice. This will lead to a loss of healthcare administration jobs, but 1% of the total budget is slated to go towards relief for those affected by this loss. Economists predict that 99% of those who lose jobs will be reemployed after retraining within 2 years by other aspects of the medical industry, and many of the people in medical administration would rather be in medical care anyway. These bills would also set all private prices to match those that Medicare currently pays for services, cutting the price of drugs in half and drastically lowering the monopoly pricing from hospitals. Yes, someone will have to lose the money that would have been profit, but it should be the moguls and corporations that have made billions exploiting the system for so long. things aren't all upsides, and doctor salaries will go slightly down. That being said, doctors are largely in favor of this change, both because it would allow them to spend more time dealing with patients, and because they'll save money on their own healthcare costs. In fact, the video you're watching was commissioned by a group of doctors in Western Massachusetts. Under the current system, insurance companies aren't required to cover all the different kinds of doctors you might need to see. The proposed Medicare legislation, however, will ensure that all Mass residents have access to dental care, behavioral health care, eyeglasses, hearing aids, in-home health care, nursing home care, along with a plethora of other healthcare options you don't think you'll need until you do. In fact, for the sake of comparison, we've shown the projected price tag for the current system as if it gave everyone access to all of these services. But even if we showed the projected costs of healthcare in 2021 without expanded coverage, the savings would still be massive. The difference in cost between the current system and improved Medicare for All might seem impossibly large and too good to be true. But remember that the US spends nearly twice as much per person on healthcare than other similarly industrialized nations. Even in the new system, we're spending more per person on healthcare than Canada. In improved Medicare for All's tax plan, you'd have to make over $1 million just to see a 9% increase in your medical costs. And even if you are a millionaire with excellent healthcare coverage, there's no need to worry, because as we've already said, none of that will change. You'll still get the same wonderful access to your favorite doctors, and all the money that the average resident saves on healthcare will go into goods and services and stimulate the economy. The bottom line is that Medicare for All is a better system. And the even bottomer line is that it's also cheaper. The only requirement for free healthcare is 90 days of residency, meaning it's not tied to your employer. We all learned how easily a job can go away last year, and healthcare shouldn't go with it. These bills will institute a board of trustees to oversee the system. The board will be made up of representatives chosen by nursing unions, doctors, public health professionals, and other experts in these fields, along with 8 representatives directly elected by the public. Under the current system, you can't vote out members of corporate boards for your private insurance company. Under the new system, if you don't like the way that the trustees are allocating funds or setting prices, you can vote them out next election cycle. So I hope that we've done a good job of showing you that this system makes logical sense, even though it's pretty sad to me that we had to. Healthcare is a human right, and we should all look to pick those up around us who've stumbled. At least that's what I was taught. Here's what you can do to help push this legislation through. First, and most importantly, you can contact your state legislators and tell them to support legislation to enact improved Medicare for All. As we're filming this, these bills are being actively worked on by committees of legislators. If these specific bills don't pass as is, tune into healthcare advocacy groups to see what new form they've taken on. Legislators will keep tweaking them, and advocacy groups will keep fighting for Medicare for All until we win. The more citizens put pressure on elected officials, the sooner this will pass. And in the meantime, you could also volunteer time or money to any of these organizations. Lastly, and most challengingly, you can have empathetic conversations with friends and family members who don't understand or don't agree with Medicare for All, and get them excited about this. Show them the costs of our current system and the benefits of this new proposal. And while you're at it, share this video far and wide so that we can get this to as many people as possible. Remember, the most dangerous thing to a corrupt system is an educated electorate.